Welcome back, Leominsterites, to the September episode of Representing Leominster. We took a little bit of a break, so you've been watching some reruns over the summer, but we are so excited to be joined by two of my favorite people at the Leominster Police Department, Janessa McQuaid, who works on the Leominster Opioid Task Force, and Leslie Borges, who's the domestic violence advocate. And I don't know if I'm using your titles correctly, so I'm going to make sure that you get them right. And first, I just want you to talk a little bit about the work that you're doing, and then I would love to talk about some of the events that are coming up and some of the work that we do together. So, Janessa, could you give me a little bit of your background, how you became to be in the role, and what you do at the Leominster Police Department?
I came into Leominster in 2017. I was hired through the Leominster Police Department for the opiate outreach program to get a hands-on trying to assist people with addiction issues. I respond to the overdoses and try and give them treatment if they want detox. We try and navigate that for them. If they do not, we continue to follow them and offer them like a guide. I worked into this field for about 15 years. I've worked at MASAC, which is Section 35 program, a detox, outpatient as well, and then I came here. We're pretty active in Leominster.
Absolutely, and Janessa is not telling the whole story. We're actually using your program as a model kind of in the state that I've gotten a chance to, at least in the last budget cycle, really highlight both of the work that you're doing and show my colleagues just how well it's working in Leominster and how much progress we're making, whether it comes to addiction and the opioid crisis or just supporting domestic violence survivors to feel safe in our community and welcome in our community. And we secured some state funding to make sure that your work could continue and become sustainable within the city's budget, and I'm so thankful for the resources you provide, because our office is in constant contact with you because both of these issues impact us so much. And I just want to thank you for all of the work that you're doing. It's unbelievably difficult, and we know that it's draining, and so I want to make sure that folks know what you're doing, how they can access resources, but also just lift up the awesome work that you're doing.
Well, thank you.
Leslie, could you tell me a little bit about how you came to the Leominster Police Department?
I was working through a grant through the YWCA Central Mass at the Leominster Police Department. Unfortunately, the grant was over, and the chief of police decided, because we have such a great outcome and program at with the domestic violence victims, that he decided to, put me as a city employee, and I'm very pleased for that. My background is a social worker. I've been working for Clego Neighborhood Center. I was the deputy director for many years, so I'm well known in the community. So I think that's what. It's all about. I love my community and continue working with the Leominster Police Department. It's such a great
and so
opportunity.
Folks are trying to get a restraining order. If they're in an unsafe situation, they can come and talk to you, and you kind of help them through that process, and you accompany them through the legal process?
Yes. I'm the first person, the victim called, or I called the victim after the incident of domestic violence once they called the police. Or if they don't call the police, if they want to come to me, it's either or. So I guide them through the system, and I guide them to the program, refer them to the proper program, and as you know, we refer everybody, and also make sure that they are safe and the safety plan is in place with other community agencies. So we are like as a team, we work everybody together.
Yeah, and with September and October, these are big months for both of you with Overdose Awareness Day in September, and October is National Domestic Violence Awareness Month. So I know we have a couple of events coming up in terms of vigils where community members can come together, remember those that we've lost to the opioid crisis or through domestic violence, and also for those to celebrate those who are in recovery and those who are safe in their community and out of an abusive situation. So I know that the candlelight vigil, shining a light. This is going to be the first time that we have
Here in Leominster,
a vigil
yes.
here in Leominster. You and I were at the one that happens kind of regionally in Gardner, and I'm
Gardner.
so thankful to have you organizing one here in Leominster. And it's going to be Wednesday, October 2nd, from 6 to 8 p.m.
Yes.
And I think that we have a flyer about it.
We
So
do.
there will be a flyer. And something I noticed on the Facebook page is the ability to commemorate a loved one.
Yes.
So how do folks do
So
that?
they would email me the picture. The email is on the flyer, and we will put it together on a video for people to remember their loved ones, as well as this is Recovery Month, so we want to share that recovery is possible as well. So we do have guest speakers coming on that are in recovery to share their stories, and we'll have resource tables for those that are still struggling or that have family members that are still struggling to obtain information to different programs as well.
Throughout the year, you're hosting these kind of resource events, and I think for all of us who are trying to figure out how to support loved ones who are in recovery, loved ones who are struggling to get into recovery, and to be able to deal with their addiction or come to terms with their addiction. I'm so thankful for all of the resources that have been popping up, and for you to kind of help us navigate how to get through all of those resources.
Family support is important as well for the families. So there'll be information for families to attend meetings and things like that as well at the event.
Absolutely.
So.
I think folks often don't give enough space for family members who are going through the trauma of losing a loved one, and making sure that they have the support and tools and how to help someone through it. And that the same goes with domestic violence. I think we talk about the cycle of violence and how to be a loved one when you're seeing someone go through this cycle of domestic violence, and how do you be there to support them when you're worried about their safety? How do you deal with that trauma? And could you talk a little bit about the resources here in North Central Mass that you work with?
I work together with Jeannie's Food Pantry. They are awesome, I have to say. Spanish American Center, the YWCA Center Mass, Catholic Charities, Salvation Army. We work also with Worcester, together with Worcester for any placement of the child. DTA, we do have someone in there that she's like an angel for us. We call her every Friday. It's like a team. We in Leominster, we come all together and we make sure that the person is saved right away.
Yeah. And can we talk a little bit, just shifting gears, about your work with kind of homelessness? Both of you have been really involved in this in kind of supporting a warming shelter in the city, because we're realizing that there are more and more homeless individuals and families in our community, and just as many services as we can provide, there's not enough.
Correct.
And so I want to plug two things that are on my social media. Wednesday, September 25th, and Tuesday, October 8th is a volunteer training. If you've heard about the warming shelter, it happens at the Office of Emergency Management overnight when the temperatures drop below freezing, right?
Below 15 degrees
Below 15.
or weather and climate involvement.
Or, if there's going to be a really bad storm, they'll open it up. And it's been a really great partnership between the city and a lot of different service providers to make sure, and I think in just helping folks know that there's a safe and warm place to go, and then connect with other services. So for folks who want to volunteer, it could just be one night that you're able to take off and be there and help folks who don't have any other place to go that's warm and safe. Wednesday, September 25th, and Tuesday, October 8th, Isabel and I are going to be at the October training, so we would love to have you come. And it's a really, really great way for us to continue to let all of our community members know that you're safe, you're welcome, and we want to make sure that you have a safe and warm place to go. One of the biggest issues that we have dealt with in Leominster is kind of the growing rise of homelessness in our community and surrounding communities, and just how to make sure that we have the appropriate resources to help them, and that folks feel safe, that there's trust. And I think the roles that you're both playing in the police department, not everyone is always really, really thrilled to see a police officer which is a shame, and we should feel safe. And I think so many, between the Leominster Police Department, the Fitchburg Police Department, there's such a focus on being available in the community, and our police officers are doing that hard work to build up that trust and those relationships and make sure that folks know when you're in trouble,
Yeah.
they're
that
there
they
to
can
help.
call.
Yeah, and they're gonna show up, and they do so much to make sure that we're safe. And it's so great to look at kind of holistically, how do we support domestic violence survivors? How do we support those who are struggling to be in recovery, or those who are struggling with homelessness, and make sure that everyone has value in our community. And I know that there's something else happening with T-shirts around the. Is there a fundraiser
Yes,
happening
so
with T-shirts?
last year we did the gala for a fundraiser.
Right.
It provides transportation for those that want to seek shelter in a different location. We don't have a shelter here, so the closest one is Fitchburg. The other shelters are in Worcester.
Worcester.
So that would provide transportation for them to go there, or if people are wanting to go into detox, we'll provide transportation if they don't have it. And then with Leslie's program, we utilize it as well for her clients.
We absolutely never want transportation to be a barrier for someone entering into recovery or fleeing a domestic violence relationship.
Transportation's a huge issue.
Yes.
Yeah, we just saw new reports. Like we know every day how hard it is for folks to get around in North Central Mass. I think maybe sometimes the folks east of us take it for granted that they have access to a T, even when it's not running great. There is a subway system in the greater Boston area, and for us, we're trying really hard to save our regional transit, make sure that folks can get in and around the community in a way that is cost effective for them and gets them to their appointments and wherever they need to be on time.
And that's the other issue that we run across, that they have appointments to set up treatment or go into the DTA to get assistance, things like that, and they don't have transportation to even begin their journey. So we try and help out as much as possible. That's why this year we're doing the T-shirts. They're $20, and they're blue and black. I don't know if they have the pictures or not.
Sure. I'm wondering if, Leslie, you can talk about kind of for someone who sees a loved one in a domestic violence relationship, or someone who is realizing that their relationship is really unhealthy and dangerous and they want to leave. How can they safety plan, and how can they reach out to you to get more resources and more support to help with that?
They can either come to the station and ask for me, Leslie, or they can either call me at the station at the 978 local number, and we do an intake, and we decide what is the best for them. Sometimes the victim is not ready to leave because they are like right there in the cycle of domestic violence. But we give them I give them the necessary keys and the resources that they can have, and put it back in the mind. When they are ready, they can come back with us, to the police station, and we can start the process. If they need to leave, if they need to be in a shelter, we right away put them in a shelter, but with the safety plan right away, what they need to do. They need to file a restraining order, or maybe it's not suitable for a restraining order, but they need to leave. We just guide them through the process. Housing, DTA, food stamps, at least, we alleviate through the mayor's fuel assistance. We just provide them, with the $300. We help them in so many ways. With the Spanish American Center and the YWCA Central Mass, they help them and guide them through the counseling process to see where they at. So we need, when we work with the victim of domestic violence, we need to work where they at the moment. When they're ready, they can come back with us, and we deal with the process. With children's too, and they involve so many, domestic violence involves so many things: economic, financial, mental abuse. It's so many things that we can deal with. But the risky part, and I'm part of also the high risk between Fitchburg, Lancaster, and all the surrounding areas. We do have a high risk teams that we help and alleviate that part through the DA. Make sure that if the person is incarcerated, or if the person is going through the net of in a criminal case, we make sure that the victim is safe first, and we also make sure that we know where are the abuses is, so to make sure that the cities are safe.
And something that I've been seeing more than occasionally is also pets and their role in making sure that their pets are safe. And sometimes that could be the reason why folks aren't ready to leave, because they don't know where their pet, which could be just like their kids,
Yes.
is going
Since
to go.
2016, you can add your pet at the restraining order.
Yeah.
Yes, you can add your pet at the restraining order. So, and it's good in the whole Commonwealth. And also, we do have now a shelter in Lowell that takes pets.
Yeah, and there's one in South County that also does take women and their pets.
Yes.
And we have worked, just for anyone who might know of a situation where it's needed, we have a lot of other places locally who are willing to help foster pets and make sure that there's a safe place for a pet to go temporarily when they can be reunited with their owner when it's safe to do so.
Yes. Yeah, we accommodate and we try to do the best for the victim.
Yeah. Janessa, can you talk a little bit about how we could help loved ones talk about their addiction or access services? And because I think some people are worried that sometimes it's like going into an inpatient facility, and that could be appropriate for folks. But there's other support systems to kind of ease yourself in.
So recovery is different paths for individuals. There's not one black and white form, and I think a lot of parents want that. What am I supposed to do next? It's individually, you have to find out what they want to, what they're willing to do. Yeah. Sometimes it's inpatient, sometimes it's outpatient. We refer a lot of people to AdCare, which is in Worcester. One good thing about AdCare is that they transport their clients, so if they do sign up, they will pick them up, drop them off, no matter where they are. And they will give them they'll go to meetings, and they have a lot of resources there. Inpatient is 5 to 7 days, and that's just the detox piece. It's navigating what's going to happen when they come out, and a lot of people fear that as well because they want them to go into the next stage, which is maybe a CSS, and there's not enough beds, so it's not guaranteed. So some of these people that do want it have to come home because there's not a bed available. To go into detox and say I'm going to stay in for a year, it's hard because the next bed may not be available. So we try and navigate the different programs. There's many programs, and to not stipulate on just one program, fill out applications for everywhere and see where it takes you. Sometimes a new environment can help you, and don't be afraid of a new environment. The jobs are a huge issue as well. Absolutely. And housing, like we just spoke about housing. To put someone into treatment and then come back and be homeless, it's an issue. And they need jobs to pay for a sober home, things like that. So we have done the Second Chance Job Fair in the past that they overlook medication-assisted treatment, quarries. We will be looking back into doing that since the community wants it. Residents here would like to attend again. So it's providing all those resources. It's not just getting the drugs out of them, but okay, what are we going to do next as well?
And making sure that, the bed issue. I'm really thankful to serve on the Mental Health, Substance Use, and Recovery Committee for the second term in a row. And we're hearing statewide, like there's enough beds. Well, there aren't enough beds where we are, so something's wrong. And when someone is dependent on trying to keep their job, so they can't go across the state, how do we make sure that folks' families are as intact as possible? If they have kids or parents that they want to be connected with that are an important part of them in their recovery, how do you make sure that they have access to each other? And
many of them still have responsibilities, like you said. They have children that they have to take care of and raise, and it's just not the homeless person that doesn't have a family or anything. Many people that are struggling in addiction have those responsibilities still.
Absolutely.
And we need to help them guide how to deal with that as well.
I'm on healthcare financing, and the thing that surprised me the most was finding out that Mass Health actually provides the most robust detox in terms of insurance coverage compared to our private insurers.
Correct.
And how frustrating that could be to know that depending on what insurance you have, whether or not you're actually going to have access to the proper length of treatment. That this isn't something that you can go into a 5 to 7 day detox and be like, okay, I'm done, and I'm all set, and everything's fixed. Like that this is something that takes so long. In conversations we're having around medically assisted treatment, how is that available for folks who end up in, I was just over at a celebration at one of our nursing homes. They're having a growing number of folks who are on medically assisted treatment come in for complex medical needs and rehab through a nursing home, and they can't administer medically assisted treatment. They have to put someone in a van, get them down, transport them to wait in a line so that they can get their medically assisted treatment at the clinic. There's gotta be a better way for us to be able to make sure folks have access to treatment, can be successful, and make it, there can't be that many hurdles, folks. And we finally figured out the issue in our county jails, making sure that folks have access to medically assisted treatment, and that's finally rolling out. Like, no one should have to worry about their recovery being broken because of being incarcerated. That we should absolutely make sure that they get that medicine. We wouldn't say to someone who has diabetes, sorry, we're not going to give you your medicine, because you made this other decision, and now you don't get access to the medicine that you need to be able to live.
I see a growing change, and it's good. But there's a lot more work that needs to be done for, like you said, the access to the medication-assisted treatment. It works. It helps people, and we need to be open to all of that. Stigma needs to stop going around medication-assisted treatment. I hear all the time, well, they say I'm not clean. Is it helping you? Is it helping you with your issues? You know, it's it's diagnosed as a brain disorder now.
Yeah, it's a public health. There's finally being treated as a public health issue. And I'm glad that that's happening, but it's taken us a long way to get there, and not everyone is on the same page. So I'm glad for both of you. I mean, also Leslie, with domestic violence, so many folks think it's this simple thing like, oh, that's wrong, that your relationship is unhealthy and dangerous, and you need to get out and you need to leave, and that it's that easy. But you talked about that. There's so many things that make it really, really difficult, and it's not always bad. Right? That's why it's a cycle.
Yes, it's a cycle, yeah.
And how do we help people, and how do we do, one thing I'm really passionate about is doing early education and talking to our middle schoolers and our high schoolers for both of these issues to make sure that they can spot the warning signs and help their peers get the support that they need. It's a whole lot easier to teach our kids how to be in healthy relationships than to deal with someone who is a domestic violence abuser and is an adult and try to show them how their behaviors are completely unhealthy and dangerous. It's so much easier to have those conversations early. So I want to plug, before we wrap up, the events coming up. So Shining a Light Candlelight Vigil for Overdose Awareness Month is Wednesday, October 2nd from 6 to 8 p.m. And then we have later that month the Domestic Violence Vigil that I've been at in the past on October 21st. So if folks can come, please join us. Are they happening both at City Hall?
Yes.
Okay. So both at City Hall, we have the flyer for the Shining a Light on Recovery. I'm so thankful that you ladies are bringing these resources to our community, that you both have these positions. It's something that can be uncomfortable for us to talk about in our community, but this impacts every single city and town across the Commonwealth. And we need to make sure that we're making that investment in providing resources for all of our community members. So I'm really thankful for you joining us today. And if you haven't gotten a chance to meet Leslie or Janessa and you want to get involved, if you want to work on any of the homelessness prevention, the warming shelter, please reach out to them at the police department. They're unbelievably accessible, and they need help doing some of this work. They can't do it alone. And they're working with so many community partners. So if you're interested in getting involved in any of the work that they're doing or supporting any of the work that they're doing, please reach out. So we will see you in another month. And I hope to see you at some of these events in the meantime. Thanks so much.